Hello, I'm Dr. Valas from the Family Pet Hospital in Ashland, Massachusetts, and I'm here to help you learn a little bit more about laser therapy in dogs. So Judy, my assistant, is going to ask me a couple of questions, and hopefully you'll be able to determine if laser therapy may be something that you'd like to explore for whatever condition that you are concerned about in your doggie.
All right, so Dr. Vallis, how is laser therapy used to treat dogs?
So laser therapy is used in many different conditions to treat dogs. And basically what we do is we shine the laser, which is a very focused light, to the dog's surface in an area that we are concerned about, that maybe he's having pain or had an injury. And the light is absorbed by the cells in those areas, and the little mitochondria, which is the engine that produces energy inside the cells, absorb that light and produce energy. And so essentially that cell in that tissue that we're trying to heal gets more active and starts functioning better and starts healing that area.
Okay, and why should I consider laser therapy for my dog?
Well, because a lot of times these dogs are in a lot of trouble, they're in a lot of pain, and subsequently we have them on a lot of medications. And so if your animal isn't getting better, they're going to need more and more medications. In particular, say an older dog with hip dysplasia and arthritis is going to be on a lot of anti-inflammatory medications, as well as possibly things like gabapentin, tramadol, which are also pain medications. And at a time and an age where the organ function is also declining, this is not the best idea for your dog. So laser therapy can improve the quality of life. It can decrease the pain and subsequently also decrease the amount of medications that you're using on your pet, giving those organs like his kidneys and his liver a chance to recoup as well.
Okay, and what is the difference between the different therapies and when might the veterinarian recommend them for my dog?
What the different laser therapies?
Yes.
So there really is only one major modality for therapeutic laser, and that is a low level frequency specific laser. And that's a lot to say, but what it means is it's not a laser that's going to burn the tissue or cut the tissue. It is very low level. And frequency specific is that we're actually targeting specific cells in the area of injury. So for instance, if a dog is having had an ACL tear or an anterior cruciate ligament tear in their knee, which is very, very common, unfortunately, we're targeting those cells. We're targeting the ligament cells. We're targeting the connective tissue cells. We're targeting the muscle cells, the joint cells, the inflammatory cells, and we're getting them all working together. So the key though is that there are some lasers out there that may be too high power, and those lasers actually can decrease inflammation and can minimize pain. But if you get a low level laser, you actually are affecting what we call biomodulation, what that means is actually changing tissues, making tissues heal, not just taking away the pain, not just taking away the medication. Not just taking away the inflammation and the medication, but also changing the tissues for the better, helping them heal. So that's what you're looking for. You're looking for a laser that can not only take away your dog's pain, but also affect biomodulation and actually change the tissues for the better.
Okay, and what conditions can laser therapy be used to treat in my dog?
So we have several conditions that we can treat. I think that the one that I treat the most is the anterior cruciate ligament tears because we see them all the time. So we definitely treat a lot of those, but we also see arthritic dogs. So older dogs, those are also my favorite because these dogs are on a lot of pain medications, and a lot of them have to have blood work every 2 months to check the liver and the kidney function. And if you can take them off those meds, it really is a unbelievably rewarding thing to do. And I have been able to do that in the older dogs. Maybe not completely, but cut them down to a minimal amount that is not going to be harmful to their system. So arthritis, big time. We also have things like bladder infections, chronic cystitis can help. Dermatology, like allergies. We see a lot of dogs with really bad skin allergies. Again, we have very good medications for that, but they are medications, they are drugs. So sometimes doing the alternative healing with nutritional products as well as laser can really help. Disc injuries, like a blown disc, a bad back pain. Sometimes some of the brachycephalic dogs, like with the pugs and the French bulldogs, Boston Terriers, they have really bad neck issues. Those do really well with laser therapy. Chronic ear dogs, very bad ear inflammation. Those do very well with laser therapies. And then the other common conditions that may be causing pain, such as just an acute injury. They really hurt themselves, but it's just a ligament injury. They don't need surgery. They just need anti-inflammatory medications. But again, sometimes they stay lame for a long, long time. LASIK can get rid of that and get him back to functioning. The other favorite, and actually in my practice, we do laser after all our surgeries. So that's for post-op pain. So they wake up more comfortable. We actually also use the laser, the surgical laser in surgery, which also helps with pain. But on top of that, we will give them a laser treatment after surgery. So that's also super, super nice. Again, taking away that acute pain, but also getting the cells to work better, because surgery is an injury of sorts. You actually cut tissue, you have damaged tissue. So now you need to repair it. And the body is going to repair because that's what the body does. And the laser is just going to help them, those cells, do it even better.
Okay. And what can I expect from my dog's laser therapy appointment?
So when we do the laser therapy, we're doing usually about 3 to 4 different sets of frequency, and each of them take about 3 minutes. So you're looking at anywhere between 15, 20 minutes if we're just doing the laser. Usually we add the VOM. So you're looking at about 20-minute appointment. Most of the time, unfortunately now with COVID, we have to bring the dog in the back and do it ourselves. But when COVID gets done, hopefully, you are usually participating during this therapy. So I like that because I think that way owners see how relaxed and happy their dogs are doing. They come in, they lay down, they get their what I call their massage, the spa day, and they go back out with their tail way up and wagging. So it's always a rewarding vet visit versus having to cut their nails and do shots. So they like the laser therapy a lot more than anything else that we do. And but at this point you would be waiting in your car or somewhere doing an errand for 15-20 minutes while we do the treatment.
Okay. And how long will a laser therapy session last for my dog?
That's about 15 to 20 minutes.
Okay. And then how many laser therapy sessions will my dog need?
So that again has to do more with the chronicity of the problem. So if it's an acute problem, we're usually done in 5 to 7 treatments. If it's a more chronic problem, and certainly if it's an ACL or a back, we're probably be looking around 14 to 15 laser treatments. And like the veterinary orthopedic manipulation, we do spread these treatments out. But when I have a really bad acute condition that I want to get going on, such as an ACL, which is the knee injury that I treat a lot, those guys, the first week, literally live here. They have 2 treatments, 90 minutes apart, the first 3 days. So they're here for 3 hours the first 3 days. Then they have daily treatments for another 3 days. And then the following week, they have 3 treatments that week, then 2 treatments the following week. After that, they get the rest of the treatments along with the veterinary orthopedic manipulation. So I think you've been hearing me mention veterinary orthopedic manipulation along with laser. And the reason for that is because both of them alone do really, really, really well. But when you add them together, it's like 1 + 1 = 5. So they're helping each other out. They're making each other more effective, as it were, than if you were to use them alone. So frequently, especially with the more serious, more painful conditions, I put them both together and we use them together.
Okay. And what are the risks of laser therapy?
So very little to none. So the laser therapy that I use, we don't even have to wear goggles. So that's how safe it is. Obviously, we can't shine it inside our eye because that will harm us. But you can be in the room without having any goggles on. There are certain lasers that are higher class lasers that you need to wear goggles. So the other thing, because it's a low level laser and it's very safe, you're not going to get a skin burn. You're not going to get anything like that. And then the final question mark that everyone always asks is, what if my dog has cancer? And no, we are not going to feed that cancer because we're doing laser therapy for arthritis. Say, we're going to make your dog more comfortable. They're going to be less pain. They're going to need less medication. And you actually are improving the function of all the cells around the cancer. You're using specific frequencies that are absorbed by specific cells. And what that means is if you put a certain frequency into the laser, and it's just basically you plug in these numbers, a cell that doesn't recognize that frequency is not going to absorb it and it's not going to produce energy. So we don't have any frequencies for cancer. So when we use the laser, the cancer cells don't know what to do with it. And it'd just be basically like water in the shower on your body. It's just going to go right through, right across it, not going to react. But the rest of the cells are going to get back to work and they're going to become stronger and work better. So one of the side effects is you have a stronger, happier body, and so a stronger, happier animal overall. And it's not going to cure the cancer. So it's not going to change that. Unfortunately, that condition is going to stay unless you're doing chemo, but it's not going to make it worse either.
Okay. And then last question, how will I know if laser therapy is working for my dog?
Because you'll see it. So most of the time, this is one of those where the placebo effect is not possible. So I don't know, some people can project into their animals and you can say, well, yeah, I think he's feeling better. But I think, if you're paying for a service, you're going to be looking for results, and you're going to either see that your animal is happier, walking better, getting up and down the couch better, going up and down the stairs better, feeling overall happier, like grabbing his toy and bringing it to you before he was a lump in the log. Like all of those things are indications that your animal is happier. And that is what I'm here for. I mean, essentially, that is why I became a veterinarian. I didn't become a veterinarian just to, spay and neuter dogs, or to do surgery, or to give pills to dogs. My ultimate goal is to create happier pets. So you will see that. And if you don't see that, then laser isn't working. It's as simple as that. If you do not see a happier, much better functioning dog, then that condition that your pet has is not responding to the laser. Fortunately, there's few conditions that won't respond, but some of them don't. I'll tell you, one of the things that I feel like will decrease the success in a knee injury that I keep talking about is if there is a click. And that's an audible, something you hear in the knee. You flex the knee and it's like click, 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 click. That's usually a pad between the two bones in the knee called the meniscus. And when that is ripped, it flaps like this in the joint, and it's super painful. And laser, VOM, acupuncture, nothing is going to fix that. And it's still going to be painful, and it's still inside the knee. So a lot of those dogs have to have that taken out because it's annoying. So there are certain things that we know that are going to decrease our chances of being successful. And when I see that, I usually let you know that it's not going to work. We can keep trying, but most likely this dog is going to need to get someone to go into his knee arthroscopically or doing full surgery to fix that. Okay. So the key is, if it's going to work for your dog, you're going to know it. And so am I.
Okay. And then if I have more questions regarding dog laser therapy, what should I do?
Well, you can call us at the Family Pet Hospital, 508-231-1223, and ask to have a consultation with me. If we're, want to have a consultation for laser for VOM, the initial consultation is always free. I'll tell you what I know. I'll tell you what I see in your dog. I'll tell you whether I think that they're a good candidate or not, and any other testing that we need to do to determine that. And then we'll go forward. If you want to go forward, we'll start treating your dog right away. Actually, now that I mention it, like one of the things that I found in dogs in particular that will make both veterinary orthopedic manipulation and laser less effective is hypothyroid disease. So if your dog is fat or has really kind of scruffy hair coat or something like that, or has a lot of chronic infections, I'm going to be suspicious of thyroid disease, and I'm going to want to test before we start the veterinary orthopedic manipulation, because if they are hypothyroid, it probably won't take as well. So I want to make sure that that's corrected before we start, using your money to treat them with VOM or laser.